I'm the nurse practitioner today. How are you doing?
I'm good, thank you.
Great. So what brings you in today?
I'm just here for a physical.
For your yearly physical. Any complaints today?
No, not at the moment.
Okay. So I'm just going to do your head-to-toe assessment. We're going to start from your head all the way down to your toe. The medical assistant checked out your vital signs, your hearing test, and your visual test, and they all came out normal.
Okay.
So this is Victor. He's a 36-year-old male in for his wellness exam. Today I'm going to, and he's relatively healthy, and I'm going to go ahead and start his physical. I'm going to start with his head and his face. Of course, when he came in, I also want to check for his cognition to make sure that he's alert and oriented and he's not confused. Starting with his hair, I want to make sure that I'm able to palpate. Come closer so you can see. Go ahead and palpate. Go a little further. Palpate his hair to make sure that there's no infestations and the distribution of his hair is distributed evenly and that he's clean. Also, the skin on his face is clean. His hygiene is pretty good. And his face is symmetrical. We're going to go ahead and check your trigeminal nerves right here, and go ahead and open your mouth, Victor. And go ahead and and then move your jaws side to side. Right, and clench your jaws. Any pain there?
No.
Okay, great. Go ahead and puff up your cheeks. I'm just gonna let the air out, and go ahead and raise your eyebrows. Okay, and we noticed that his eyebrows were raised symmetrically and evenly. We're gonna move on to his eyes. His eyes, they have no abnormal drainage. I know today Victor's eyes are a little bit red because he's a little bit tired. And the outer canthus of his eyes, both of them just line up at the top of his ear, and they're symmetrical. I'm going to check for his lacrimal ducts right here. No drainage there, no pain there, Victor?
No.
And his mucosa, his conjunctiva is pink and moist. And his eyes, and let me just grab my pen light to check his pupils. And we're going to check your pupils, and they do constrict. Great. And while we're here, we're going to go ahead and check your cranial nerves 3, 4, and 6 for your extraocular movements. Go ahead and follow my fingers, Victor. And that's in a star pattern, and you can see that his eyes are able to follow where my fingers are at. And just look at my nose, Victor. And go ahead and cover your left eye. All right, and go ahead and bring it back down. And then go ahead and cover your right eye. Go ahead and bring it back down. And we just make sure that there's no wandering of his eyes and that they're consensually accommodating. And I'm going to get my fundoscope here and check also the vessels of his eye. And we want to make sure that we're able to follow the vessels. And I'm going to check his right side. And I'm going to have my camera move over here. I'm a little short. And I see the red reflex. I follow the vessels of his eyes. There's no nicking, and there's no cupping of the optic disc. And then I'm going to do the same on his left eye. Again, I see the red reflex. I go ahead and follow his vessels. No nicking in the optic disc. There's no cupping. Any problems with your eyes recently, Victor?
No.
Great. And up next, and we're going to move on to his ears. His ears are symmetrical. I'm going to palpate his ears, his pinna and his tragus. Any tenderness there or pain?
No.
Okay. And I'm just going to make sure I get a visual of your ear canal. And here, I'm going to go out and up for adults. His ear canal is clear. His tympanic membrane is gray. It's pearly gray, and his cone of light is at 7 o'clock. And I will also do the same thing. Out and up. And his ear canal is clean. A little bit of cerumen. His tympanic membrane is pearly gray. Any problems with your hearing recently, Victor?
No.
Okay. And also, his ears, we're going to move on to his nose. Have you been sick lately?
No.
No, okay. So I'm just going to palpate. I'm going to make sure I assess the skin. I'm going to palpate the bridge of his nose. Any tenderness there?
No.
No. And then just go ahead and have your chin up so I can take a look at your nose. Go ahead like this. And his nasal turbinates is midline. His nasal mucosa is pink and moist, no abnormal lesions. And of course, throughout this exam, we want to assess the skin all throughout to make sure there's no infestations, palpable nodules, and things like that. And then up next, I want to make sure that, we want to make sure so that's his eyes, ears, nose, and then his mouth. And his lips are symmetrical. Again, his hygiene is good. There's no abnormal lesions that I can visualize here. Open your mouth, Victor. And here, we're just going to make sure that we take the time to look if he has all his teeth, if he has any dental caries, dental work, or any abnormal lesions. Go ahead and put your tongue up the roof of your mouth. And the base of his mouth is normal. And say ah. And his uvula stays midline, and his tonsils are not swollen, so we don't have to grade that. So we did his head, his face, his eyes, his ears, his nose, and now his mouth. And his mouth didn't indicate any swelling. And his soft palate is, his hard palate is fused, and his soft palate is pink and moist. Soft, pink, and moist. So that's his mouth. We're gonna go ahead and move over to the patient's neck. Here we have a visual. Of course, we start with the skin, and we make sure that he's clean. There's no abnormal lesions that I can see, and that his skin is the same all throughout his body, or the same color throughout his body. Again, we visualize that his trachea is midline, as we can see here. And while we're here, we want to make sure to see if we can see any extra pulsations, which we can't. And I can go ahead and palpate his carotid artery. Of course, I can feel it right there. And of course, we don't do that at the same time. And while we're here, I don't have a bell on the stethoscope, but if I had a bell on the stethoscope, we want to make sure that we listen to his carotid arteries to make sure there's no bruits. So I'm going to pretend that this is a bell. I'm going to take a listen anyways. And I don't note any jugular vein distension here with Victor. The neck exam also includes checking out his lymph nodes, or palpating his lymph nodes. We're going to go pre-auricular. Any tenderness there, Victor?
No.
And then post-auricular. And then submandibular. Submental. I don't feel any abnormalities here. And then subclavicular. So just for my train of thought, we did his head, face, eyes, ears, nose, mouth, neck, and then moving on to his upper extremities. Right here I have a visual of his clavicles. It's even. His shoulders are even, and I also have a visual of his scapula in the back. So it's all even, and we want to make sure he has appropriate range of motion. But at first I'm gonna go down and feel his acromion process. And as we go down, I'm gonna ask if there's any tenderness, palpation, or when I palpate. Any tenderness here, Victor?
No.
And then what about here on your joints?
No.
And as we go down, we can also check the temperature of his skin, and check his fingernails, and check the radiobrachialis pulse. And then I also check cap refill, and it's brisk, and his radial pulse. I'm going to check his acromion process on the left side as I did on the right side. Any tenderness here, Victor?
No.
And then here on your elbow?
No.
Okay, and here we'll check cap refill, and we'll also check brachioradialis pulse, and both left and right are bilateral, both pulses. And while we're here, go ahead and I'll check your grip strength, and go ahead and squeeze, and his grip strength are equal. So moving on down, that is his upper extremities. We can go ahead and move to his posterior back, but I think I forgot something, and I want to make sure that you have range of motion in your wrist. And prior to that, before we go to his posterior back, I want to make sure that he can also shrug his shoulders. That's part of the neck exam as well. And then make sure that you have a range of motion in your shoulder, just this way, and the other way. Sorry, I missed this part of the upper extremities. And also we can check his range of motion by this way. So the range of motion in his upper extremities, and you can move your wrist this way, and your elbow. I missed that part earlier, but I want to make sure I complete that. So up next is, go ahead and face that way, Victor. Yeah, go ahead and face that way. We're moving on to the posterior back, so we can take a listen at his lungs. Again, we also want to make sure that we have a visual of the skin on his back, any abnormal lesions, any abnormal discoloration, tattoos or scars, and we want to make sure we take note of that. And if he's sustained any injuries or new injuries, we can ask the patient about that as well. His scapula, again, is symmetric. So I'm going to compare left to right, and just deep breathe whenever you feel the stethoscope on your lungs. And while we're here, I'm going to check for vocal fremitus, and go ahead and say 99.
99, 99, 99, 99, 99, 99.
And you should hear some muffling during that examination. And we'll check tactile fremitus, 99.
99, 99, 99, 99.
And down here, as we go down, we're going to hear, we're going to feel less vibration. And of course, we note that the symmetry of his thorax, and the thorax shape, and we want to make sure, and we can see that the AP diameter is 2 to 1. So we can continue listening to the lungs on the anterior side, and we'll also move on to listening to heart sounds thereafter. Just go ahead and take a deep breath. I'm just finishing. So now we finished listening to his lung sounds. I want to move over to his heart sounds, and we want to move over to the heart sounds using ape to man. Ape to man, it would be aortic, pulmonic, Erb's point, tricuspid valve, and the mitral valve. And we want to make sure that we notate S1 and S2. Notate that if there's any extra heart sounds or any murmurs as we go down. Just breathe normally. I'm just listening to heart sounds. So, aortic, pulmonic, go ahead and come here. Erb's point, tricuspid, and the mitral valve. Okay? And Victor is not particularly a large individual, so I can also try to palpate for the PMI, or the apical points here. And we want to make sure that we do this assessment when he lays down, so that we can have a comparison between our findings when he is laying down versus when he is sitting up. Go ahead and lay down for me, Victor. I'm just going to do the same thing. Again, ape to man. Do you have a visual of me, the both of us? Aortic, pulmonic, Erb's point, tricuspid valve, and the mitral valve. And it's all normal. I hear S1, S2, and no extra heart sounds. And I'm just going to try to palpate his apical point, or PMI, here. Okay. So I've done the heart sounds. Now he's laying down. We can move over to the patient's abdomen, or Victor's abdomen. Again, if this was in clinic, I have a visual of his upper body, and the skin would be exposed. We want to make sure that we notate if there's any abnormal lesions that are visible, any scarring, tattoos, and make sure that we notate symmetry or asymmetry. So with the abdomen, we of course want to auscultate, auscultate, percuss, and then palpate thereafter, because if we percuss and auscultate, that will elicit more peristalsis. So Victor, you haven't been sick lately, right? That's what you told me earlier?
Correct.
So I'm just going to listen to your bowel sounds, and I'm probably going to hear some gurgling, because you did eat recently, right?
Yes.
All right. So this is Victor's umbilicus here. I'm going to start with the right lower quadrant. His bowel sounds present here. Right upper quadrant, bowel sounds present there. Left upper quadrant, and then left lower quadrant. And there's bell sounds all throughout all the quadrants. Since I already have my stethoscope on, I don't have a bell, but I would like to take a listen at vascular sounds. And we use the bell to listen to vascular sounds. This is aortic, renal, iliac, and femoral. And we listen to vascular sounds just to make sure there's no bruits. So after auscultating, we're going to go ahead and percuss throughout the stomach just to make sure that we have normal findings. I guess I can keep this here. And I'm just going to start from his left, going down, upward motion all throughout his tummy or his abdomen. And we'll do that. And throughout this entire process, you should hear timpani. As part of this process, we want to make sure we also percuss the spleen, which is going to be on the left side, closer to the 6th intercostal space. And how we do that is we also percuss for it. Go ahead and take a deep breath. I know it's kind of hard to hear. Go, take a deep breath. And we should hear timpani. If we hear any dullness, it could indicate that the spleen is enlarged. So after the spleen, we're going to go ahead and percuss for the liver. So we're going to go from top down to bottom up to locate the liver, and then we're going to make sure this is his clavicle. We're going to go mid clavicle right here. That's about where I hear it, and we're going to start from bottom up here. This is and his liver is just about there. So after percussing, we want to make sure we're able to do deep palpation. Typically, we don't palpate sometimes we can't palpate the spleen, but we're going to go ahead and try. Go ahead and take a deep breath. We're going to go to the 6th intercostal space. Just right here. Okay. And the spleen is just about there, but sometimes you can't. And then we do that for the liver as well. And go ahead and take a deep breath, Victor. I'm sorry, take a deep breath again. And as he takes a deep breath, we can make sure where his rib cage are. His rib cage are about right here. And we palpate the edge, we can palpate the edge of the liver just about here. If it goes beyond the edge of the rib cage, it could mean that the liver is enlarged or cirrhosis. Just one step that I forgot prior to this. So I did the percussing and the palpation of the spleen and the liver, but I missed palpating the entire abdomen here. Any tenderness here, Victor?
No.
Okay. 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 And we can watch the patient's face if he's grimacing, if there's any pain there. Okay. All right. All right. And while we're here, we also want to check for signs of appendicitis, which we're going to perform McBurney's sign. And this is the umbilicus, and this is the iliac crest. And we're just going to go 2/3 down. I'm going to press on your tummy, Victor. Nothing's hurt so far, right?
No.
Okay. Oh. Did that hurt?
No.
Okay, great. So that means he does not have appendicitis. And then, we can palpate the kidneys as well, but that requires deep palpations, and oftentimes that can be painful for a patient. So that's the abdomen. And while we're here, we're going to go ahead and check the hips. And is any pain there, Victor?
No.
Okay, I'm just going to go ahead and put your knees to your chest. Is any pain there?
No.
No, and go straight. And then where I'm going to go, turn your knee this way. Any pain there?
No.
No, okay. And of course, if I had an examination bed, I would do the same exam on the other side. Great. And then, so that's his abdomen. And then I'm going to move you over back to your chair. I'm going to move you over back to your chair. So we did your abdomen, and now we're going to do your lower extremities. And I need my reflex hammer. So for for the lower extremities, again, we want to inspect the skin, notating if it's the same color, same color as the rest of his body, any bruises, tattoos, scarring, and things like that. So you get a visual of it. And I'm gonna make sure I start off with his knees, and we're gonna go all the way down. Any pain there?
No.
Okay. And of course, Victor, can you feel me kind of grabbing on your legs?
Yes.
Okay. And then here, and then you can feel that too.
Yes.
Yeah. So we're gonna check the patellar tendon here, and you're gonna isolate the tendon here, and I'm gonna strike it. All right. And on the other side, I will do the same thing and make sure that I check his knees, any tenderness here, and you can feel my hand grabbing your calves. And what about your toes? And while I'm here, I can also check for cap refill and sensation. And we also want to strike, all right. And then, I'm sorry, but I forgot the Achilles tendon, and we elicit that by dorsiflexion, and I know I can identify his Achilles just right here, just behind there, because he's dorsiflexed. And then go ahead. Okay. And any pain anywhere, Victor?
No.
Okay. So, as part of the neurological exam, we also want to make sure that, you can stand there. As part of the neurological exam, we also want to make sure that we assess for dystaxia. Victor, go ahead and walk to the hallway there. Okay, just by the plug. And go ahead and walk back to me. And heel toe, or with your heels. Okay. And then go back, and with your heel, and then heel, what is it, heel? At the back.
Oh,
Heel, and then earlier you walked with your toes.
Yeah.
And then just with me, you do heel, toe, heel, toe, heel, toe. Wonderful. And while we're here, I want to make sure that I check for the patient's Romberg test, just to make sure that there's no lesions in the brain. Go ahead and do this, Victor. Close your eyes. And then, so he has very minimal swaying, so that means that it is a normal Romberg test. I just want to touch base real quick on a part of the I think we're done. Go ahead and sit down. I just want to touch base as part of the neurological exam. There's what's called extraceptive sensation, which is synonymous with superficial sensation. So what that means is if the patient can feel superficial pain. If this was a needle, I could go ahead and ask Victor if it hurts or not. If I put more pressure on there, does that hurt more, Victor?
No.
It hurts? It doesn't hurt?
No.
Okay. But if this was a needle, Victor would let me know that he's experiencing pain. And then for extraceptive sensation, go ahead and close your eyes, Victor. Is this hot or cold?
Cold.
Okay. And is this warm?
Warm.
That's warm. And proprioceptive sensation also, can you see me? Proprioceptive sensation deals with it tests position awareness. So if Victor was to close his eyes, go ahead and close your eyes, Victor. Where am I touching you?
My right arm.
Your right arm. And what about this?
My left cheek.
And also, if I was to hit this tuning fork, tell me when the vibration stops.
My time stops.
It stops. And what about this side? Hang on.
Stops.
Okay, perfect. And that's proprioceptive. And proprioceptive sensation tests for positional awareness, so he knows where those stimulus is. And cortical sensation is a combination of superficial sensation and situational. I'm sorry, not situation. Position sensation. I'm sorry, let's start all over. So cortical sensation is a combination of extraceptive and proprioceptive sensation, so both superficial and position sensation. Position awareness, I'm sorry. So that's position awareness. So what cortical sensation means is that we are processing the stimulus that we are experiencing just based on personal experience. For example, go ahead and close your eyes, Victor. And this is what's called a stereognosis. And then go ahead and close it, and what do you think is on there?
A chapstick.
Chapstick, okay? And then keep your eyes closed. What letter did I just write?
I.
And then what about this one?
Oh.
And then that's called graphesthesia. And then extinction is also a part of the cortical sensation. And I think I've also demonstrated that earlier, where Victor tells me where the tuning fork stops vibrating. And that's that. Up next, I'm just going to move over here. Go ahead, we're going to take the chair, Victor.
Oh.
Okay. And then go ahead, cameraman, you can go over there. And then I'm going to assess your spine. We're going to move over to your spine. And as you can see here, Victor has normal curvature of his spine. It points out outward, inward, and outward towards the sacrum. And go ahead and act like you're diving, Victor. And then I'm just going to check the base of his spine. It's smooth, no palpable nodules or anything like that. And any pain there, Victor?
No.
Okay, go ahead and stand up. Go ahead and stand up. And then make sure, and then I'm just going to hold your hip halfway towards, turn halfway to on your right side. Okay, just like that. Okay, any pain there?
No.
Okay, and the other way too. And then you could go ahead and hyperextend your hands all the way and hyperextend towards any pain there.
No.
Okay, so during your examination, Victor, did you have any questions or did you feel any pain or tenderness while I was doing your examination at any part of that time?
No.
Yeah. Okay, great. Thank you so much.
No, thank you.
All right. So for the upper extremities, I just briefly missed the deep tendon reflexes. I just want to make sure I include that. I know it's not part of the 30-minute frame earlier, but at least it's included. So I have the tricep tendon, the bicep tendon, and the brachioradialis tendon for this patient. So for the tricep tendon, his tendon is just about, this is the tip of his elbow, the ball joint here, and his tricep tendon is just about there. I'm going to go ahead and just strike it. And then for the bicep tendon, go ahead and just relax. And go ahead and flex your biceps, Victor. Okay, and the tendon is just right there, and relax. I'm just going to strike it. And then, all right. And so for the brachio, just relax your hand. Brachioradialis is just about there. And it should show some flexion.